This is Max. He's come into the hospital with a deep abrasion on his knee from falling off his bike. Luckily, our human bodies have a special clothing process that responds to his injuries to prevent and stop bleeding. This is called hemostasis. Hemostasis is a vital process that prevents blood loss, which is an essential fluid in the body that provides nutrients to cells, removes waste products, and transports vital properties. It is also crucial for protecting against infections and restoring vascular integrity. It is a rapid sequence consisting of 3 phases: vascular spasm, platelet plug formation, and coagulation. These all work in chronological order to reduce mass loss of blood, also known as hemorrhage. In the first stage, smooth muscles contained in the blood vessel wall suddenly contract together through its circular layers, causing a vascular spasm. This constricts the blood flow to reduce blood loss for up to a few minutes or few hours. While this is happening, the endothelial and cells lined in the vessel release peptides called endothelin. The endothelin, along with pain receptors, respond to damaged vessels by initiating a spasm. The next stage is called platelet plug formation. A platelet plug is formed through platelets changing and binding together at the damaged parts of the blood vessel. This plug fills the gap in the blood vessel wall to stop blood leakage, just like a cork in a bottle. This stage entails 3 processes: platelet adhesion, platelet release reaction, and plate aggregation. Platelet adhesion is the attachment of platelets in the connective tissue to impaired parts of blood vessels, including the collagen fibers. Then platelet release reaction occurs, where platelets activate and dramatically change their characteristics. These platelets extend numerous projections that enable them to interact, and from there they begin to liberate the contents of their vesicle. These liberated chemicals then activate and maintain the vascular spasm. The released chemicals also cause platelets to become sticky and attached to each other. This is called platelet aggregation. As the number of attaching platelets grows, it forms a large mass or a platelet plug. It is initially loose but becomes tightened by the fibrin threads, producing coagulation. Coagulation is the final stage, in which a fibrin mesh of filamentous protein originating from fibrinogen is formed. It then encapsulates platelets and blood cells to form a clot. Fibrin mesh formation begins in 2 ways: the intrinsic and extrinsic pathways, where both lead to the common pathway. Internal damage to the blood vessel triggers the intrinsic pathway, causing multiple clotting factors to activate. These factors include fibrinogen, prothrombin, Christmas factor, Stewart-Parr factor, plasma thromboplastin, and Hagemann factor. The Hagemann factor is activated when damage is inflicted upon exposure to endothelial collagen. This factor therefore activates the next factor, resulting in another factor in a water-like effect, also known as the coagulation cascade. At the same time, when traumatic injury impacts surrounding tissue, it triggers the extrinsic pathway, also known as the tissue factor pathway. An enzyme complex is formed upon contact with blood plasma when damage occurs to the extravascular cells outside of the bloodstream. This comes from the release of factor 3, thromboplastin, which activates and adds calcium ions and proconvertin. The end result of both activation chains produces the Stewart-Parr factor, also called factor X, and leads to the common pathway, which is the fibrin production of sealing off damages in the vessel. Factor X also causes another cascade effect to create soluble fibrin protein strands and to stabilize the fibrin clot. Once these stages are successful, Max's body will begin to create a blood clot, healing the blood vessel and wound, as well as preventing thrombosis and hemorrhage. As you can see, understanding hemostasis and the mechanisms to prevent blood loss in the body is pivotal in developing effective treatment for those with bleeding and clotting disorders, such as hemophilia, Wallenreich-Brand's disease, and immune thrombocytopenic purpura. Therefore, hemostasis in all of its 3 stages are extremely vital to preserving our bodies when injuries occur to prevent further complications of blood loss and infections.